Hey, what's going on, Facebook? How we doing today? I'm excited to do another edition of Ask Me Anything. I definitely have a question today for you guys. And I just want to say, first off, thank you so much for all of you guys that input and ask me these questions because I really love answering them. I've actually just started a podcast, so if you're actually listening to this on the podcast, thank you so very much. I'll try to do my best not to make this non-visual because you guys are listening, probably driving in your car or riding a bike or working out, what have you. But today I have a message from a person, and you know what I think I'm going to do? And I'm really curious about this, what you guys think, is that I think I'm going to put an area on my website because I'm getting lots of emails of people asking me questions, which is great, but I would actually like to hear your guys' voice as well. So I just was researching about something called a plugin that you can put on your website where you can leave me like a voicemail. And then off the voicemail, I can actually play that and then use that as part of a Facebook Live or YouTube Hangout or a podcast that you're listening to right now. But until I get that put into place, just simply go to drbeau.com and then underneath the Contact Us button, you can click there and input your question for me. Also, if you're watching this on YouTube, I do my very best to go and answer all of your guys' questions underneath. So if you have a comment, please leave it. I was just on there probably about a half an hour ago answering questions about Osgood Slaughters and then about carpal tunnel. I know where there's hundreds of comments, and that's awesome. And I really do my best to go through and answer all the ones that I can. And, I think that's kind of one of the big things about why I'm doing this. It's all about transparency for me, guys. I just really want to be 100% open, 100% transparent. Because I believe in the world of healthcare, especially when you talk about doctors, there's a lot of crap out there. And there's a lot of stuff that's not true, a lot of stuff that's not evidence-based, a lot of stuff that's built off of fluff and not research. And I really want to do my best that everything I provide for you, every answer that I'd be able to, or every answer I'm able to give, that I really just provide 100% honesty and truth. So I want to talk a little bit about today. I got an email the other day from Jessica, and Jessica says, "Hey, Dr. Beau, I was playing in a basketball tournament this weekend, and I rolled my ankle. It's really big, it's really swollen, and it's starting to get black and blue. What should I do, and what should I not be doing for this ankle?" All right, so Jessica, let's talk a little bit about sprained ankles. So a sprained ankle, and again, I'm not diagnosing you, and none of this is diagnosis, by the way, is I'm just giving you guys my opinions about things that I would or would not do. Most common form of a sprained ankle is what they call an ankle when the foot is inverted, so your toe goes in, your big toe would be pointed in, and the foot rolls out. So they call that inversion with external rotation. And when that happens, the most commonly injured ligament is what they call your ATF, your anterior talofibular ligament. There's a mouthful, anterior talofibular. Matter of fact, they say that almost 90% of all ankle sprains happen to this anterior talofibular ligament. And what you are experiencing is when that thing tears, or when you've ruptured that ligament, you're getting a lot of blood flow, a lot of swelling. In our world, we call that edema, and that's what is causing your ankle to swell and get bigger and bigger and bigger. Now, a couple of things that you need to note about this. The first thing that is that the swelling is actually a good thing. What that means is that the body's trying to expand to allow nutrients to rush in and actually heal that area. That's why we have swelling in the first place. So as the swelling is occurring, the body, the lymph, the blood is bringing these nutrients to help heal the area and to start laying down some of the nutrients that are needed to rebuild and repair that injured area. So swelling actually is a good thing. Now, the amount of swelling and the duration of swelling, those are the two things that we really try to control. So the swelling's okay, guys, so don't freak out about that. Now, a lot of people are asking me, well, why does it get black and blue? Well, when you tear blood vessels, when you tear muscle tissue around it, we're also dealing with a lot of other structures that can be injured, and it's bleeding. You're internally bleeding. Matter of fact, most people that when they have a sprained ankle, the black and blue doesn't necessarily show up the first or even the second day. It's third, fourth, fifth, sixth day is when that black and blue gets really, really bad. So here's kind of some basic parameters all around that. The first thing that you want to know, it's a very simple acronym, and they use the term RICE, and that stands for rest, ice, compression, and elevation. So what we're going to do, if you just recently sprained your ankle, the first thing that you want to do is you want to ice the area down. Typically you use an ice bag, a frozen peas, what have you, whatever you got as far as ice, and apply it for about 10 or 15 minutes at a time. You know, research is showing us that after about 15 minutes of ice usage, the therapeutic benefits actually decrease significantly. So, 15 minutes on, 15 to 30 minutes off, 15 minutes on, 15 to 30 minutes off, that's probably the best idea. Now, obviously, we're going to rest it. So that is our rest, that is our ice. Now the most controversial one is compression. Now, 10 or 15 years ago that they would tell you that you should try to ace bandage it starting at your toes and working it all the way back up to the mid-calf. Now, research is kind of 50-50 on this, to be honest with you guys. Another thing that's really, really big right now is the use of kinesio tape. Now, what does kinesio tape do? I think I've made another video. If not, I'll make another one on it. But in essence, what kinesio tape does is it actually helps to lift the skin, which helps to increase the amount of movement in the area. It actually lifts the fascia up and helps the lymph and the blood flow to flow better. Now, we have a lot of that stuff that's happening down at the organic level, at the area of injury. Then what we want to do is try to use the kinesio tape to help decrease the inflammation. And what kinesio tape is first off, you have to understand it's not for support at all. Matter of fact, if you look on the bottom portion of kinesio tape and we kind of stretch it out a little bit, you'll see that it has a lot of flex to it. And the reason is that you can use kinesio tape in a bunch of different ways. You can use it to pull a muscle or fascia in a certain way, which in essence turns muscles off, or you can pull it in a different way, which turns muscles on. Or you can do what I suggest is when we have an injury with a ankle sprain, is to take the kinesio tape and actually make what they call a finger. So if you're watching this, you have one solid piece and you cut the bottom in like a half U shape, and then the top portion of it you cut little finger lengths, so you just cut straight down. Now, if you're listening to this on the podcast, just think about half of it looking like spaghetti on the top and the other half being solid. And what you do is you lay two pieces of this spaghetti-like fan, they call it a kinesio tape fan, at 45-degree angles from one another, and you actually crisscross them so they look like a waffle type of pattern. And what that does is it actually helps to lift the skin and helps to decrease the edema. And this is being shown to be way more effective than actually the compression using an ace bandage all around it. The last thing they talk about is elevation. And what elevation really means is that if you sprained your ankle, you want your ankle higher than your heart. And that helps to increase the flow of the blood back to the heart faster, thus helping to aid in speeding and recovery. Now, a couple other things that I highly suggest, Miss Jessica, is first off, if you are involved with a sports chiropractor, you should definitely have that doctor check it out. I will say that on average, and I've probably seen a few hundred of these in my practice already at this point, I would say less than 5% are probably actually broken. Your ankle is extremely flexible. Unless you had crazy trauma where you fell on it from a really weird angle or something like that, chances are that it's probably not broken. However, you definitely want to have a conversation with your sports chiropractor or your general physician. Sports chiropractic is actually pretty amazing for it because a lot of the times when the foot does go inverted with external rotation, the talus, which is the bone that's on top of the ankle, actually gets really subluxated and out of position. And by having that adjusted very gently and put back into place, that can actually help increase your ankle mobility a little bit and hopefully actually aid in the recovery even more so. In addition to that, you just have to be very careful over the next few days. Again, sometimes depending on the severity of your ankle sprain. Now, they actually qualify these things or classify them in a category 1, 2, 3, and 4. So 4 is considered a complete rupture and tear, and that's typically something that you're going to have looked at by an orthopedic surgeon. But most people, I would say 80 to 90%, fall into that, 1 or 2 area. So for just a normal ankle sprain where it gets swollen and kind of out of alignment or what have you, usually you rice it rest ice, compression elevation, kinesio tape. And then we start doing some very easy range of motion over the next couple of days. Now, I don't want to go into too much depth about that. I guess we can do that on a different podcast or what have you. But just understand this, is that ankle sprains happen. They're very, very common. And just following the RICE protocol is extremely important. If the foot continues to swell after about day 3 or day 4, if you start losing feeling in the foot, you have numbness and tingling, those are some signs and symptoms that you definitely want to pay attention to. And if you're experiencing those, then it's definitely time for you to have a conversation with your doctor, your sports chiro, your orthopedics, what have you. In addition to that, we really send a lot of people to physical therapy as well. Physical therapy works extremely well in conjunction with chiropractic care in the fact that they can really work on the ankle mobility, also the coordination and the stability, and all three of those have to be retrained when we have an ankle sprain. Last thing I want to say is this, is that a lot of people say, Beau, once I sprained my ankle once, it seems to happen over and over again. And I would 100% agree with that statement. And the reason is because when you first rolled your ankle, or first sprained your ankle, so to speak, you've torn that ATF ligament. And that ligament will never heal back as strong as it was prior. Why? Because scar tissue is replacing what the normal tissue was, which means that the muscles that surround that ankle, the ligaments and the joint capsules, have to be worked to become tight, to become very, very strong, or else you're going to have this continual ankle sprain over and over again. So I hope that was able to answer a few questions for you guys today. I know this is about 10 minutes, and normally it's a little bit shorter than that. I'm sorry. If you have questions about ankle sprains, or if you've had one done, hey, you can post a picture below, or ask your question. Like I said, I'll do my best to absolutely jump on and help you guys out. Until next time, feel free, ask questions. I'm always here for you. I'm here, like I said, transparent and to tell the truth about healthcare. Dr. Beau, signing off. Talk to you.